today student we will talk about bronchiectasis. The definition of bronchiectasis is means abnormal dilatation of the bronchi and which causes chronic suppurative airway infection with productive of sputum, that is copious, and progressive scarring of the lung causing lung damage. That means bronchiectasis will cause by infection that causing the lung bronchi to dilate, and there will be production of suppurative sputum. The etiology varies. It's two types. The causes are two types, one congenital, another is acquired. The congenital cause is cystic fibrosis and some ciliary dysfunction syndrome such as carcinoid syndrome and primary ciliary dyskinesia. And the acquired cause is infection, that is pneumonia, could be tuberculosis or could be bronchial tumor. The three. Bronchiectasis can affect any age group, that means the children or the adults, because it is of two types, congenital and of acquired types. Bronchiectasis, there are some symptoms. The symptoms, usually the patient will present to us with cough, productive sputum. The sputum will be foul smelling and copious, large amount of sputum. There could be pleuritic chest pain. During cough, patient will feel pain in chest. There would be fever. Fever may or may not present, but it may be present. And sometimes there are hemoptysis when the infection increases and destruction of the bronchi along with the bronchial vessel. From the bronchial vessel, the blood leaks to the bronchi and there would be hemoptysis. And there are some general disabilities such as anorexia, weight loss, exertional breathlessness. Patient feel shortness of breath during walking or working, and there will be weight loss. Now, how we will investigate? Our investigation will focus identification of infection. We will do the complete blood count test first. The hemoglobin may be decreased or normal, ESR will rise. Total count, the WBC count will increase, neutrophil count may or may not increase, lymphocyte count may or may not increase. CRP will be increased. We will do the sputum for gram stain culture to identify the organisms, along with the sputum for AFB stain to identify the tuberculosis and AFB culture, and gene expert of the sputum to identify the tuberculosis. We will do the chest X-ray. In chest X-ray, there will be dilatation of bronchi. Chest X-ray is not that much specific. To diagnose it, we need the chest a CT scan, HRCT, we call it a HRCT, high resolution CT scan of the chest, and it will show the dilatation of bronchi, the ring shaped bronchi, and there may or may not be some fibrosis and some pleural thickening. Pleural thickening is a findings of bronchiectasis. And we will also do the Montauk's test, empty test, to exclude the tuberculosis. And another screening test to diagnose the ciliary dysfunction, because bronchiectasis may be due to congenital ciliary dysfunction. You know that lots of cilia are present in the nose through to the bronchi. Their main function is to beat they work as a brush border to wash any particle, bacteria, virus or dust. So, we will put a saccharin. Saccharin is a sweet ball, sweet ball. We will put a saccharin in the nose, front of nose, and within 20 minutes the saccharin will go to our mouth from the back. The cilia will beat the saccharin. Within 20 minutes the patient will feel the sweet test of saccharin. If they fail within 20 minutes, it proves that there are some ciliary dysfunction. So the patient will be diagnosed as primary ciliary dyskinesia or Cartagener's syndrome. If there are Cartagener's syndrome, there will be some sinusitis and transposition of viscera. That means our heart is in the left side. In the Cartagener's syndrome, it will be in the right side. Liver will be in the opposite side, left side. Stomach will be in the right side. That means there will be the viscera transposition. Now, after the diagnosis, we need to manage the patient. If we identify it, there are infections such as pneumonia or TB, we will manage it accordingly. For management, we will do first a physiotherapy, chest physiotherapy. Patient need chest physiotherapy first, then the antibiotics. Antibiotic will be given according to the culture and sensitivity, but before that we will prescribe the patient with some prophylactic broad spectrum antibiotics such as cefuroxime, ceftriaxone, amoxicillin and clavulanic acid combination, that is coamoxiclav, because the organism may be gram positive or gram negative. Okay, so we also have to prescribe anti-pseudomonas antibiotics because there are some pseudomonas that may complicate the infection, and pseudomonas antibiotics are such as ciprofloxacin, tazobactam, piperacillin and ceftazidime. So along with that antibiotic, we may prescribe that anti-pseudomonas antibiotic along with it, and after the culture came, we will prescribe according to the culture sensitivity. If there are tuberculosis, we will prescribe anti-TB drugs such as Remestar 4-FDC. It will combine 4 drugs: rifampicin, isoniazid, pyrazinamide, ethambutol for 2 months, then Remestar 2-FDC for another 6 months. Now, patient will have some cough, so for cough we will give some bronchodilator such as salbutamol or salmeterol along with some steroids such as fluticasone combination. Fluticasone. If the patient does not respond, or if the bronchiectasis is chronic or there are some lung damage and the response rate is less, then we need to do surgical treatment. Bronchiectasis may affect bilateral or unilaterally. So, if one lobe or one segment of the lung is affected and patient does not respond on conservative treatment, then we need to do the lobectomy or the segmental section of the lung, then the patient will respond. Now, about the prognosis of the disease. Actually, the disease is progressive when there are congenital factor present such as ciliary dysfunction and cystic fibrosis. Ciliary dysfunction, the patient prognosis is poor. In case of acquired cause, the prognosis is good by oral medication or by surgery. It can be treated well. Now, for prevention. Actually, bronchiectasis starts from childhood, following the childhood infections such as measles, whooping cough or primary tuberculosis, and inadequate prophylaxis and treatment of this condition may lead to bronchiectasis. So, we need to treat the patient from childhood, and we need to prevent those measles, whooping cough and treat the primary TB. We can prevent the measles by giving vaccine. In the next class, we will talk about tuberculosis and its investigation, management and symptom, how it presents. So, hope for the best.